Hi, everyone, and welcome to the show.
Aneurysm,
Thank you
aorta,
so much for
aneurysm,
being here. We really appreciate it.
mhm.
I'm just going to be a little bit of a Debbie Downer to start off this show, just because it is so personal to me. And last night I was on my way to go on a date, and suddenly I'm in my car and I just burst into tears. I was like, where in the world did this come from? And it was because, all day we're getting prepared for this show that we're doing today, and it just brought back so much, emotion that I really miss my mom. My mom transitioned 2 years ago, from an abdominal aortic aneurysm that they had not detected. Yes, she had a thoracic aneurysm, um, but they said it had not dilated to a point where they were concerned. But standard protocol does indicate that if you do have, or they do find, a thoracic aneurysm and the upper aorta, that they should check the abdominal. And they never did that with my mom. And so she ended up passing in my arms while we were on vacation. And it's still every once in a while, it just hits me. And last night I ended up calling a really good friend of mine. When they answered the phone at 10 o'clock at night, their time on the East Coast. I'm in California and I'm in tears and I'm saying, oh my gosh, my mascara is running. Help me laugh. Help me just get back in the game here so I can go on this date and be cheery and live my life as my mom would want me to. But it was really hard that moment. I'm even starting to get a little emotional this morning as we head into this show, because it is going to be about aortic aneurysms. We do have Carin Andersen, who is the founder and executive director or CEO of Aortic Hope, which is a foundation that supports people with aortic aneurysms. And we're going to talk to her about her experience and her journey with an aneurysm that led her to starting this organization to not only help herself, but to also help others like me, because ultimately I did find out that I too am starting, I have an aneurysm in my aortic root in the upper aorta. And so that's something that now, just to add fuel to the fire, right? In that emotional sense, it makes me wonder what my fate is. Is it going to be that of my mom? And so, wow, I can see your face, John. It's a rough start to the today's show.
Well,
It's really emotional.
number one, happy Saturday. Number two, Kim, we
You're
we
always good to turn it around. Thank you.
we have we do, I think, a really good job of balancing pretty heavy topics and then adding some levity to it and just trying to make it as easy to talk about as possible.
Yep,
The aortic
as
aneurysms are
real.
tough, right? Because a lot of times people don't know they have them, and then when
Yep.
they find out they have them, it's oftentimes a little bit too late. The beauty of what you knew enough, and unfortunately, what happened to your mom, at least the silver lining there is now, you have one, and it can be monitored, and it hopefully won't grow, and it's just something that it is what it is.
Right.
You don't want it to be like the sort of Damocles kind of hanging over your head. And that's a lot of times when I see patients who have them small aneurysms, it's you're part clinician, but you also do a little psychoanalysis with the patient and
Yep.
try to help them to understand that, yeah, you have it, but it's probably going to be okay. So
I mean,
that's
but you
important.
feel like a ticking time bomb. You wonder if this cup of coffee that I'm having this morning is going to raise my blood pressure and cause that aneurysm to dilate. You wonder if, when you're exercising and you're raising your heart rate, are you also exacerbating that aneurysm? I mean, it's a constant battle in your mind. And so I like that you said, yes, you got to get into that a little psychotherapy as an interventional cardiologist when you do have someone that comes in with something like this, because it hits you right there in your head.
Well, 100%. But again, control what you can control. You can't control the genetics behind it. You can't control the fact that you have one, but you can control what you do from a risk factor management
Right.
standpoint. Exercise, we know exercise is good. We know aerobic exercise is good. We do caution about isometric, lifting, but and then watching blood pressure and just kind of, it is what it is, right? And
Yep.
you can either be a prisoner to it, or you can allow it to kind of set you free to some degree. So let's vote for the latter, huh?
I think that that's the only way to be. It's easier said than done, but it's the only way to live. There are so many different things, right, in our lives. Anything can happen at any moment, any time. And so it's just that little extra reminder that you do need to, I'm going to be cliche and just saying that you do need
But
to just live.
let me just say this morning, since I'm on call, we had what's called a STEMI alert. Patient came in with having an acute heart attack or cardiac arrest, and a young man who unfortunately died before we could get him into the cath lab. And the history that we got was he had been having symptoms for about a week of chest discomfort, and whatever, ignored them or just thought nothing of them. But the point is, listen to your body. If there's
Mhm.
something, like if you have the opportunity to change, to go left instead of going right, do that. Listen to your body, because now this poor man's dead. And so it's a cautionary tale for sure.
It is. And I hear it all the time, especially with patients that they feel sometimes brushed off, by their doctors because they don't have, for example, with my dad, with when he was on the verge of a heart attack, he had the feeling of indigestion and they were going to just brush him off with some Prilosec, or he had trouble breathing and they said, well, it's because you fell last year and you are just out of shape. And sometimes, a patient, we don't know if that patient in particular may have said something to another doctor before and they said, "Oh yeah, you're fine." Because a lot of these tests, I mean, a lot of the symptoms can mimic other things. It could be real indigestion. It could be that you're out of shape, but what if it's not? And I think that's really tough for you. And even with my mom with her aortic aneurysm, she had textbook symptoms. She had the radiating pain from back to front, front to back. She had the shortness of breath. She had the faintness. She had all of the symptoms, and yet they still brushed her off as, you're just old, you're just out of shape, you broke your lower back last year, so you just need to suck it up, buttercup, and go forward. And she was gone the next week. And so what do you do in those situations if you have this intuition? Like, she had this impending sense of doom and no one would listen. On that note, we're going to
We're
pick that up
listening.
in just
We're
a moment,
listening.
right here on the Heart of Innovation. Stay with us on Bated Breath.
Once again, here's Emmy award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Hi, everyone, and welcome back to the show. Pretty heavy cliffhanger, as Dr. John Phillips would describe it before the break. John, I'm going to leave it to you. Wonderful. There we
Dr.
go.
John Phillips, spectacular, vascular moment of inspiration.
Kimberly, hear me.
I
Can
can
you
hear
guys hear
you.
me? Oh, fantastic. Okay, sorry about that. Bandwidth is not good here here in Ohio. So the quote that I want to share is from a coach that coached the 1936 crew team out of University of Washington that won the Olympics. And he says, and I think this is really important because we've already touched on this. And his quote, so it's George Yeoman Pocock, and he's quoted as saying, "So is life. The very problems you must also support you and make you stronger in overcoming them." Did I just, Kim?
Yeah, that is amazing. And I want to bring in Carin Andersen from Aortic Hope, because I would imagine that quote probably hits right at home, doesn't it?
Everything that you guys have said since you started hits right at home. Listening to your story, your mother's story, just listening to, with the little bit that you've shared about the community, it does hit it. It does hit home. I mean, I have a story, I sit here and I think my story is not that interesting, but to many people, it tends to be interesting. So, you want me jumping right into this?
We always do. We
I,
definitely want you to just dive right in, because
yeah.
I mean, I talked about the fact that with my mom, there were symptoms, they were just brushed off. And with you, that was not the case. You had
No.
no indication that there was anything. You couldn't even give the doctor a chance to
Well,
try and catch it.
no. So what happened was, I've been very active. I used to compete in ballroom dancing. I was
Wow.
very into exercise. I was really fit. And I lived with Crohn's disease for 20 some years of my life that ran heavily in my mother's side of the family. And, it was January 2015. Well, back up on my fourth bowel resection, when they did an echo prior to, they discovered I had an enlarged aorta. So it was maybe 3.9, but nobody told me. Now, I was taking medication because I had preeclampsia with my son years before that when I had him in 1999, and it just never went away. So I was always taking blood pressure meds, but I didn't take them consistently like birth control. You know what I mean? You take them when you take them, because I'm oopsie, I didn't take it in the morning. I didn't know. Nobody explained to me the importance and the timing of taking these meds. So fast forward to January of 2015, it's a regular work day. I'm feeling great. I'm not thinking anything. It's a good Crohn's day. Everything seems to be simmered down. I came home to watch television, and all of a sudden I felt a pop on my neck. And I thought that was a weird place to have a gas bubble. And then I felt indigestion. And then I couldn't feel my arms and legs. And what felt like eternity was only really just a few moments. But when I say you can't feel them, it is like nerve block. They are just gone. And I eventually made it to the kitchen table, and I called 911, and I said, I have Crohn's, and I think I have some gas that has left my anastomosis from a prior bowel resection and is on my spine. Because that made sense to me. Why would it be anything else but Crohn's related? So they had me eat aspirin. They came with the ambulance. I walked up and into the ambulance. I'm very lucky, however, because when I got to my local medical center, they knew that my father had an abdominal aneurysm. They knew I had detached my retinas many, many years before. So did my grandmother. They knew a lot about my medical history. And so they ordered a CT scan right away, especially after doing blood pressure checks and noticing there was over 20-point difference between, limbs. So I needed to pre-medicate because I was allergic to the dye. But as soon as I came out of that CT, they looked right at me and they said, you have to figure out where we're going to life flight you because you're having an aortic dissection. And I remember looking at my husband and saying, I'm not calling my parents and telling them I'm about to die. You tell them. If I tell them, they're going to punish me. So you tell them and let them punish you. And that stands out as such a strange thing to say, but I was already beginning to have some deficits cognitively, which I guess is kind of a good thing because I really wasn't scared, but I knew that people don't typically survive an ascending aortic dissection. So long story short, which it really wasn't that long, I went down to University of Maryland shock trauma unit. 5 hours later, my surgery was over. I have a graft in the ascending, but during surgery, I dissected all the way through my aorta to the left iliac. So in some regard, I'm lucky I didn't have to feel any of that discomfort. And when I woke up, so backing up, I remember saying goodbye to my son. I remember calling my boss and telling them I wouldn't be in work on Monday. I remember calling my sister from the ambulance and saying, here's all my passwords and here's the things I need you to get out of my closet so that I won't be embarrassed if I die and people find these. It's just strange conversations, Kim, weird stuff. I had weird talks with people. I called my son's father and I told him, he's only 15. You need to teach him to be respectful of women. I just knew I wasn't going to survive. And I was angry, but I wasn't really scared. So after the surgery, I was in the SICU for about 5 days. And then they discharged me from ICU straight to home, which was not appropriate, I don't think. I think having Crohn's disease just put me in a different category. I was very fatigued. I was, it was a lot to handle. And so I came home and, fast forward a year or two, having like 2 TIAs in that time period, realizing I was suffering from PTSD and going through therapy, I needed to find something. I needed to find something, and what I was looking for didn't exist. But everybody does the same thing. They come out of something extraordinary like that and you go to Facebook. That's where you go. There was a day when we went to MySpace, but now we go to Facebook. And
that was a long time ago.
A long time ago. And you go, and I started reading things that said I wouldn't be alive in 5 to 10 years. And all the advice I was seeing was very scary. So, kind of stuck with that for about a year or so, just reading some of the information. And then they decided there was going to be this global aortic disease or dissection awareness day in 2016. So we started making plans with the hospital to kind of get involved with that community a little bit and see what that was going to look like. And throughout that first year, it was really more of, who am I? I can't work anymore. My identity, which I thought that was my identity, was gone. How do I deal with this nightmares, triggers, smelling things, hearing things that don't exist? I just had to find my bearing. I had to find my footing a little bit in that first year. And I did. And when I did, I'm going to share with you the second half of that, because I'm seeing the little prompt says 1 minute, 30 seconds, counting me down.
Exactly. You're on live radio. And so we do
So
have those
fun.
commercial breaks, and we're heading to one right now.
Right.
We'll hear more of Carin's story in just a moment. Stay with us. Don't go away.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Back, everybody, and thank you for joining us. We're continuing our conversation with Carin, who had an aortic dissection, which, as we were talking in the break, is kind of amazing that she remembers so much about it. But I think before I ask Carin a couple questions, I thought it would be important to talk to the audience about what a dissection is. So if you think about the aorta, which is the biggest tube that comes off the heart, it has some layers. And I don't know if anyone here cooks or not, but like if you look at phyllo dough, it has those fine little layers in it. So imagine having like a tube of phyllo dough, and kind of in between the layers there's lamination. And so normally the blood should flow within that tube. But if blood kind of seeps in and breaks through and gets into one of those laminated levels, it can compress the actual blood flow that's going into the main tube, and that can shut off routes to the arms, the brain, the kidneys, the gut, the legs, and basically your blood flow just kind of goes the wrong direction, and people can have these very profound, life-threatening symptoms, and the sequelae from it include stroke and paralysis. And it's definitely a life-threatening emergency. And obviously, Carin had emergent surgery. It sounds like she had a little bit of a dissection that kind of went down into one of the leg arteries, but things are pretty stable. And so, Carin, you survived this thing, right? And now you're trying to get your arms around, number one, how did I survive this? But number two, what does my life look like moving forward? And how do I readjust? The quote we talked about is, the struggles that you have in life often support you and make you stronger. And clearly you did that with Aortic Hope, right?
Yeah. So, and one of the things you guys mentioned about earlier, as far as exercise and stuff like that, when this happens to someone, when it is an emergent situation, you're afraid to get up to go to the bathroom. Further down recovery, you don't even know if you can, the first time you get a cold, you're scared to sneeze. So, and as a patient, you think it's just you. And then in the community, I realize every single person worries about the same thing. And more times than not, there is a degree of post-traumatic stress that occurs with this, because as you had mentioned, your brain kind of just needs to shut itself down to let the body have its time to heal. So around 2016, this idea of aortic dissection awareness day came to be. And I met up with two other women. One was a young girl, actually, who had a 7-centimeter aneurysm in her chest at 25 in her ascending. Wow. She had bicuspid valve. And another woman was a caregiver to her husband, who was patient X in the family with Marfan syndrome. And their eldest of 3 children had Marfan. So the 3 women came together, and we thought, let's create a Facebook page that has inspirational quotes. We're just going to make people feel happy amongst all this doom and gloom information. And we really realized very quickly that there was a lot more that was needed. There was a hole in this community that was not being filled. And we felt it. So we made these a slew of initiatives happen because we needed them to happen for us. So it really was almost an act of selfishness turned selflessness. We wanted gifts on our aortiversary. I'm just going to be honest. I want presents. So what we did is we created Hope Mail, and people signed up. That was our first initiative. They signed up to receive a little tchotchke in the mail to say, hey, we're here with you. We're cheering you on. We acknowledge you and this important date. Well, now there's close to 400 people that receive that from us every single year. And then we said to ourselves, well, we need more support. We need some support. And nobody was meeting in brick and mortar support groups. This is before COVID, but there wasn't anything. And I had been part of the Crohn's and Colitis Foundation support groups for so many years. And I know that support works, a sense of community works, a sense of belonging. So we created support groups. And what's happened is over the years, these have expanded to have a general support group, caregivers only, because they have a huge different set of needs. We have support groups for those that are grieving. And we also now have added support groups for our friends in Canada because they have a whole different set of circumstances with their healthcare, as well as we're going to be launching a Spanish-speaking support group. So the support groups initiative has really grown immensely as well as we see the needs in the community. In addition, we wanted to tell people our story and we wanted to hear other stories. So we started Survivor Series. And what that did is allows people an opportunity to share their story through a variety of ways, including on our YouTube channel, which is one of the most popular ways. They get an opportunity to share their story, which they find therapeutic. And as the community, we find validating. We also learn things and develop questions so we can take them back to our physicians. So in a way, we are also helping to educate the community to advocate for themselves and to probe a little bit more about their own health. Now, through all of this, we realized this is much bigger than dissection. What we wanted was physicians to think aorta, which is a whole other organization that's very proactive in the community, working with physicians, working with first responders to get them to think about the aorta when they're faced with a patient who's has undiagnosed chest pain. And once those patients have been diagnosed, well, now we're here to provide the support. So ideally, you want someone to find out that they have an aneurysm. We want people to think aorta, think family, and talk about their genetics and their family medical history. You want to be in that great position of having that aneurysm discovered. And I know that sounds crazy, but the likelihood of having a potentially fatal dissection, right, Dr. Phillips, it's so much lower once you know and you have that opportunity to be monitored and to choose elective surgery if you get that opportunity. So we work with patients from the point of diagnosis through their surgical intervention, through dissection, from root all the way down to the bottom of the aorta. So there is no zones for us as there is now in this organ. There is just one aorta and we're here to help everybody. And it's not just support. It's also a sense of community and giving them an opportunity to interact. So one of the things we did is we're on Facebook, but that's not where we're putting most of our attention. We're really, really expanding in YouTube. And we have AHTV or Aortic Hope TV on YouTube, where we do a lot of our interactions with physicians and clinicians, disability attorneys, and we interview and we give the community a chance to interact with us and ask questions. We also have all of the live Survivor Series there too. We also have expanded to include this big community and take people's minds off of aortic disease. We're just people, and a lot of people struggle to figure out what their 2.0 of their life's going to be. So they can join Qigong, simple exercise. They can do mindfulness and learn how to meditate and ground themselves when they're stressed. We have the aortic kitchen. So we have a chef who survived a dissection and his wife, who's a licensed nutritionist. They do cooking demonstrations and teach us about Mediterranean diet and what the DASH diet is and different things like that. We're going to be adding arts and crafts. So there's just a huge expansion that's going on in the organization. And one of the biggest things that we've done to date is we have published Aortic Dissection, the Patient Guide. This initiative was started in the UK. We got permission to bring it to the United States. We edited the whole thing. It's written by patients, for patients and caregivers, clinically reviewed, and endorsed by the Society of Thoracic Surgeons and Society for Vascular Surgery. So we've got this amazing resource to help people understand, all right, what's a dissection and what just happened to me. And aortic
it's so
disease
nice.
is coming out too. Number 2 is coming out.
It's so nice when the organizations really work together and everyone
Yes.
comes together versus what we're still finding for peripheral artery disease, which is the disease that I focus mainly on with our organization. Everyone wants to do their own thing and everyone is almost competing with each other to get the message out versus everyone really combining together. There is one initiative, Get a Pulse on Pad, but still, everyone wants to own that and versus working together. So it's really nice to see that in your community, and especially hop, skip it and jump over overseas, that you guys are working together continent to continent and trying to help patients. So that's really amazing to hear.
We're all on a highway. We're just in different lanes, and collaboration is really key, providing all vetted resources to the community.
Definitely. Well, coming up right here on the Heart of Innovation, we're going to hear more about Aortic Hope and also hear where Carin is at with her story, her journey with her aortic dissection. So stay with us.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. I want to jump right back into our conversation with Carin, because this is a lot to unpack, not only what happened to you, but everything that you guys and your organization have done. Because I think about how things get missed in diagnoses and in the acute setting of certain situations. And as an interventional cardiologist, it's always the heart when someone has chest pain. But, from us, we're thinking about, okay, what else could it be? So you guys are raising a significant awareness with respect to this disease process. And how has what you've done, I guess, translated to you personally? Like, okay, I know I have this disease. I'm raising awareness for other people. I'm living with this disease and the sequelae from it. Is my life, is the Carin 2.0 the same as Carin 1.0? I doubt it. But how have you adjusted, and are you comfortable with who you are now? And where does the Carin 3.0 go?
There's going to be a 3, there's going to be a 4. In 2018, I had complications from Crohn's, and I ended up having an ostomy, which I'm going to keep forever. And I went into remission. And then 2024, I'm out of remission. In 2023, when I went back for follow-up genetic testing, I'm not having my son, who's an adult. He's not being tested. They're just going to treat him as if he has something. For right now, we're going to leave that the way that is. Plus, they haven't found anything in me. With all of the aortopathies, everything came back negative. But I, too, lost my father very, very suddenly and unexpectedly 2 years ago. And so I decided to enhance my genetic panel to include cardiomyopathy. And lo and behold, I have a FLNC mutation. So, with that, and then having lots of arrhythmia all over the place, it's like a drum corps in my chest sometimes. It's my days are never the same. So I present this way, and I do a really good job because there's a community of people. But behind the scenes, I forget everything and I fall apart all the time because it's normal. It's natural. I got to worry about myself. What is this arrhythmia? What more medications can you possibly give me? I have to have a gallbladder removed. I have Crohn's disease. It's like the window of opportunity to not worry about yourself sometimes is just so small. However, one of the things I told Kim the other night was, I definitely believe in having a pity party. I don't think we're human if we don't. I just refuse to let it be a slumber party. I don't stay there. And one of the main reasons you don't stay in that space is because you wake up the next day. And I know that stress and worrying about these things that I can't control, I can take the medicine, I can monitor my heart rate, my blood pressure, I can walk and move my body, eat as well as I can, because I definitely like eating foods that are not necessarily great. But,
Don't we all? Don't we all?
Right, of course. I can do all those things, but at the end of the day, I'm still a human and my body's going to do what it's going to do. And as long as I follow up with my physicians, which is what we teach everybody, the importance of why you need to continue to be monitored. Why do you have to keep going to the doctor? And if the doctor's not asking to see you, you need to find another doctor because you should be followed up with. All of these things that we talk about, I need to listen to as well. And I can control what I can control, but if I let myself become too scared about what I can't control, that's just not going to do my body any good. So I learned grounding techniques, ways to just take a deep breath, ways to utilize my senses to distract my brain from thinking about that. And it really does work. So that's, I implement all of the things that we share with the community, and then I learn from them.
I love that you said that you just allow yourself to have the pity party. And it is so important, just like me last night. I allowed myself, but I knew that when I was ready, what would make me feel better?
And so I
Mhm.
think that as part of that pity party, I think the most important part is to know that one, you want to feel better. And two, what is in your reserve that you know will make you feel better? Is this a person you could call? Is it, okay, so go and have a latte. Okay, so go and have that Dr. Pepper. I'm speaking to Douglas, one of our uh, fierce advisors here. You gotta just, allow yourself to be human, right? And
Mhm.
it's so amazing that you're sharing this because I think it's really important for people to hear. It's okay to be where you are. Allow
Mhm.
yourself, don't fight it, but keep in the back of your mind something that when you're ready, one do prefer to feel better and what will get you there when
Right.
you are ready.
And I
Listen.
would just, sorry, I would just
Go ahead.
interject. I tell that to my patients all the time. That what we've talked about on the show, and I've said it several times as well. Like, I've learned so much empathy because of the talking to patients, and because of that, I'm always trying to tell the patient, like, listen, it's okay to be worried about this, but control what you can control. Do
Mhm.
not dwell on certain things that are going to be negatively affecting you. Your subconscious, and you can use, there's the term auto suggestion. You can implant in your subconscious brain positive thoughts and negative thoughts, and then those can translate into actual physical manifestations. So do your best. Put positive thoughts into your head and not negative ones. Easier said than done, but sounds like you can do it, Carin.
Well,
Right. And we
over
have,
the last couple of years, I have two aneurysms now. So, and they're at 4.7, one right at the root, one on
oh
thoracic
no, oh
descending, so
no.
past the arch. And that's very scary. It's very scary because now I'm waiting. I'm waiting to find out when my failing valve, my aortic valve, needs to be replaced. And I could sit here and be scared and I am feeling symptoms, or I can learn to take the time to do research. Let's educate myself on different types of valves that I could, choose when I have to have a valve replacement. Let me talk to the community. How was your surgery? I know I have to have this open heart again, nothing endovascular for me. Now, maybe in 10 years, if I don't need this, who knows what'll change. But I'm just using the time to educate myself. And if it wasn't for the community, I wouldn't be where I am right now, being on both different, on both sides, emergent and now, watching and waiting. And again, if therapy is very important also, I think this is often a piece that's just missed and nobody wants to talk about. And if you have a good therapist, maybe sometimes you want to consider looking for someone who specializes in EMDR, eye movement desensitization and reprocessing. So even though you didn't have a dissection, sometimes just a diagnosis can be traumatic. And every day you feel that it's trauma. Every day, what is this ping and pang? Do I go to the ER? That's jarring for somebody. But if you can find a therapist who can help download those sensations and those emotions into appropriate buckets, because our brain downloads everything we experience all day, I guarantee you're going to come out and feel better. I thought it was Mr. Miyagi mumbo jumbo until I did it myself. And I've done it 3 times now over the years because I need a tune up. And it's incredible how quickly I come out and I realize, okay, I'm not smelling anything that doesn't exist or hearing things that don't exist. I'm not being triggered. This is what it is, and use my energy to advocate, educate, and then I can communicate. Oh, I just came up with that. I'm going to write that down. Educate, advocate, and communicate with the appropriate parties. So you just like Dr. Phillips said, you just shift your mindset, and it is difficult, but if you apply it, you really can do it. You really can.
But it's interesting. So we have Marie that is sending a note in asking, when can we ask our surgeons to do something about it so we don't have to live in fear of it rupturing all the time? And we're finding that more and more with women that it ends up, for example, with my mom, ends up dissecting earlier when it's dilated to about 4. And that's what they're concerned about with me, with mine. I'm at 3.7, but they're saying because of my small frame that they really need to keep a close watch, because once it gets to 4, it's going to get into risky territory for me from my size.
So
So I'm curious to ask Dr. Phillips.
yeah, we each have a minute left, but the issue is risk versus benefit, like with anything in life. And so the surgery that Carin had and the surgery that people might need is a big surgery. And
Yeah.
so you have to understand, the patients have to understand, hey, listen, we do our best to know what the size is, know when it gets to a certain size, that rupture rate or dissection rate goes up. That's the time to pull the trigger to do the surgery, as opposed to, yes, it's enlarged, but it's at a certain size where doing the surgery, that risk outweighs the benefit of repair. Until we get to the point, if we get to the point where potentially we can do all this endovascularly, maybe, you move forward a little bit. There is some new technology out there in aneurysms that potentially with a drug might retard the growth of it. We don't know yet. So more to come, but I understand the fear, but just trust your doctor. Make sure you're seeing somebody who understands, who has good empathy.
And coming up right here on the Heart of Innovation, we'll have final thoughts from Carin and John on aneurysms. So stay with us.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. I feel like we could have this conversation for hours and hours. Unfortunately, we only have about 5 minutes left. And this is a heavy topic. And during the break, and we alluded to this earlier, there's a certain degree of fear that patients have that have aneurysms and, impending doom. Carin, we kind of hit on it, but help us to talk to patients who have aneurysms and assuage some of the fear for them, if at all possible.
I think for myself, it came down to the relationship I have with my physician. One time, for instance, a scan came back and it said that my aneurysm was now 5 point something centimeters. Now, whoever read the results and wrote the report did the length, so it really wasn't. So, but he had me come to the office, my surgeon, and he looked at me, he goes, what's bothering you? And I told him, and he goes, I want you to look at me. And I did. And he goes, I'm not bothered. You're not ready for surgery. I want you to live your life. I'm good. If I'm good, then you're good. We're all good. And I took a deep breath and I trust him and I educated myself, and I know I'm not ready, and I'm okay not being ready because I'm not really symptomatic except for my valve. I wouldn't feel that this is going on. I think, how many years did I have something to begin with and never even knew? So I look at this knowledge as power and a chance for me to build up strength. So when I have surgery, I'll be prepared for it. And at the end of the day, I can't alleviate everybody's fear or all of your fear. This is scary. I validate that this is scary. But you have to find a way, whatever is going to work for you, with all the tools that all these organizations give, to not just survive, but to strive to thrive. You have to find a way to work with a therapist, to talk to your doctor, to let your doctor hold your hand and look at you and say, this is okay. This is a good plan. And you have to trust what you're being told. Because
I think that's so important.
And I don't worry about it. Nothing's going to dissect on me right now again. I could worry about going up the street and the car drives into the wall and I'm in the restaurant. That just happened the other day to people. So anything can happen. And I don't worry about any of that.
So
to not worry about this.
So it's okay to be a Carin with a C, but maybe not a Carin with a K?
I love all the Karens with K's and E's.
Okay.
It's such a bad time to be a Karen, but no, I'm a
what's
C
up with
and
that?
I.
Like, what did Carin ever do to you?
Nobody didn't do anything. I don't even get a song with my name in, but now I got to worry about telling people how I spell it so that I'm off the hook. That's so funny.
I know. I've been waiting all show to do that. Sorry.
But that's all right.
That's
That's all
a good way
right.
to end, with a
It
little
is.
bit of humor and a little bit of fun. And, it keeps sweet. We need sweet Carin versus sweet Caroline to be
Listen,
that.
I will tell you, one of the things that we offer, and maybe Marie might want to jump into this, is we have something called Hangouts. So it is not a support group, although you sign up with the same support group registration. Hangouts are for people that don't want to talk heavy, but they want to be with like-minded people who have aneurysms, who have had dissections, and they'll have dinner together online. They'll stay online on through Microsoft Teams for 5, 6, 7 hours. It might be Dirty Limerick Day. It could be Costume Day. I don't know what they do. I jump in and get embarrassed and jump out, but they have a blast because they don't have to think about this, and they can just be a human and live and laugh and be happy that they're laughing.
I think that's such a good way to be. I love that you have so many different tools that you use. And your amazing producer, Josh, was working me through all of the different options that you have through Aortic Hope. In the last few seconds here, let people know where they can go to find all of these amazing resources if they have an aneurysm. I've already signed up because your support has been amazing, even for me, through the beginning of my own journey.
Oh,
So where
thank
can
you.
they go?
aortichope.org. That's our website. It's pretty simple. We're on Facebook. We have Aortic Hope private forum. There's also a caregiver forum, but you're going to get most of your information right from our website or on Facebook. We're on LinkedIn. We're on YouTube. We're on Twitter. Soon I'll probably be on TikTok. So who knows if I can pull off a dance, we'll get me on there as well.
And I think we're going to set it up so that we have your TV channel actually streaming into ours as well.
Perfect.
So people will get the benefit and we'll be able to be driven back to yours for more support.
Perfect.
So thank you so much, Carin, for
Thank
sharing
you.
your story.
Awesome talk. Love it.
Thank you.